Good morning. This is Steve Stites, Chief Medical Officer here at the University of Kansas Health System. We're broadcasting live from the Dolph Simons Family Studio. On my right, of course, is Hawkeye. Yeah. And on my left is a return visitor. He said hello. Sorry about that. Dr. Carrie Wieneke. Dr. Wieneke is the chair of OBGYN. She has been with us once before, and she's here to help us answer all questions about women's health and OBGYN. And she's also joined by Dr. Whitney Pressler, who's the medical director of our newborn nursery. Dr. Pressler and Dr. Wieneke are going to help us answer questions about pregnancy, labor, delivery, having healthy children during the midst of a pandemic. Yeah, good luck. We hope that all works well. A lot of words right there. How are we doing this morning?
Hi, we're good. It was good last night watching the Royals late at night at the gym.
Oh, awesome.
You know? So we have 35 today, which is unfortunate. It's a little bit more than we have had, back up to where our peak was about a week ago or 10 days ago. 8 of those are in the ICU, and 4 of those patients are on the ventilators. We didn't have any deaths overnight, so that's a good thing.
That is good. You know, you see those rapid risings in Missouri and Kansas. Missouri had the steepest curves up in the nation, although I think today there was another state that was almost as steep or as steep as Missouri. But Kansas is still going up as well, and both are concerning, and both are pretty hot red spots. So, you know, what do we got to do, Dana?
Well, I think it's the mask. I think the culture, whether it's because of the mandates or because people are doing what they're supposed to do, we need to continue that, get that more, expand that throughout all of the communities in Kansas. But also, I think starting to limit gatherings is going to be a big thing. Even, you know, on the media outlets, we saw that there was a large religious gathering in Alabama, which there were a lot of people who were infected. So it's not just the bars, and we've said that. It's other just large gatherings when you have a lot of people close together.
You know, just as a quick comment, you and I both were shared a video. I think that, I don't know if you watched it, where some reported physicians, frontline physicians, were on the steps of the Capitol saying Corona isn't that bad, it doesn't exist. I'm like, what were they thinking? Who are they?
I don't know. You know, we've heard that since day one from other physicians, I guess, or other educated people who have their opinions. A lot of that stuff is not based in fact, that's for sure. We have very good evidence about all of these things that we're talking about the way it's spread, about the ways to protect each other and mitigate and reduce the spread. And so
people who think this is a worldwide hoax and it's driven by drug companies to sell more drugs for vaccines, I'm like, do you realize we can't even keep a secret about anything? Do you think we could really keep a secret about this? I don't think so. And tomorrow we bring back one of our patients who we visited with before, Anil Garmarkar. I'm sure I didn't say his last name right, but he's back on our program tomorrow. He's back in the hospital, and he's going to be broadcasting with us from the hospital. So I think maybe we'll try and tell Dr. Mr. Garmarkar it was a hoax. I don't think he would agree.
No, absolutely not. And everybody who has lost somebody or even been sick, Anthony and his family, you know.
Right there in our studio.
It's not just numbers. These are real people, real loved ones, and so it's not a hoax.
And there's 35 people upstaiit's who had testified to that it's not a hoax.
Yeah.
So, Carrie, have you had some positive COVID patients delivering?
We have.
So it's not a hoax?
It is not a hoax. We have, within the past 24 hours, we have had positive patients deliver here on campus as well. We've been testing all patients that arrive to labor and delivery, either ahead of time if they've been scheduled for an induction or a C-section, or upon arrival. And we have encountered a fair number of positives on people that were asymptomatic. So we have been delivering positive COVID patients for some time.
Yeah. That's got to be a little tricky and a little spooky. So you guys have to wear all sorts of gear up there in order to make sure you stay safe. Talk to us a little bit about the PPE you have.
Yeah,
You're smiling. Just because you want to dress like a football player, it's okay.
Correct. If you arrive to the unit and we don't have a recent test on you, we do, of course, everyone will be in a mask and face eye covering like anywhere else in the hospital, but we will have a yellow gown on as well. And then when that collection period comes back, if you're negative, we would just be wearing our mask and eye shields. During delivery, that is the same way as well. If we have a positive patient, that would continue, and during the delivery, that would either be in a C-section or a vaginal delivery, we will wear that special mask at N95, because there is some question about the forceful nature of breathing that occurs during a delivery process, if that is an aerosolization process. And given that, to keep everyone safe, we are wearing those specialized masks. And if the mask doesn't fit the provider, then they're in that PAPR gear, which is the space-looking suit. So occasionally in a delivery, yes, there are people in those suits.
I think there's a video playing in the background right now that we were talking about that showed some of the protective gear we've had on. And if that's an earlier video, that was even before we updated our standards to the things you're doing today to stay safe.
And in that video, I think it's important to note a couple different things. I think it's a great video because you'll see that still the dad is in the room with the C-section, right? So there's always this fear of, was there any, is the mother going to be laboring alone? And we've always allowed a visitor. So dad is still in that C-section room with the mom. And so I think that's great. The other thing is dad goes to bedside to see baby, over to, not the bedside, but the crib, isolette to see baby right away and still participates in cutting of the cord. And then near the end of the video, you also see that baby still came skin to skin with mom, which, we still do and still encourage even in this time. So although it seems scary, right, or things that we don't know about, a lot has still stayed the same, and we're able to provide a great experience even in this time, and I think that's important to know.
Dr. Whitney Pressler, again, the medical director for our newborn nursery. Tell us a little bit about what's going on from your standpoint and how the pandemic's affected what you do.
Well, that's a good question. I agree with Dr. Wieneke that a lot of what we do in the nursery is still the same. It's still mostly healthy babies, happy parents, which is a pretty bright spot right now to be around all of that. Some things have changed. Probably the most common question I get now, as opposed to being about how to take a baby's temperature, how to feed a baby, how to do any of that, is how do I keep my baby safe after they've been born during a global pandemic? It's not something a lot of us have experience with, and probably a good chunk of my time now is talking about what we know and unfortunately what we still don't know, trying to make the best decision for every family.
Yeah, that's got to be a challenge. I know, just in my clinic, every time I talk to one of my patients, it's always just, are you staying safe? What are you doing around COVID-19? And we know that that's an ongoing challenge. Well, Jill, let's open up first to media and see what questions might be out there.
Hi, this is Taylor from Channel 41. You guys hear me okay?
Yeah. Hi, Taylor.
Hi.
Welcome back.
Thank you. I had a question because someone reached out to me with a question about this last week, specifically with newborns. There's been reports, at least in other parts of the world, of the number of NICU babies being down, the number of children born premature, which is obviously, I guess, classified as 37 weeks or younger than that. I'm particularly attuned to that. I'm a father of NICU babies, so I was curious about if that's something we've seen locally, and if there's anything at all that can attribute to why that may be happening. Thanks.
Go for it.
Yeah, so we actually were asked this question, and I can't tell you off the top of my head the numbers. I should have brought them down with me, but we did a look back, and we used March through June because July is not done, and we have not seen that decrease of NICU numbers. Our deliveries, and we looked both 37 weeks and under, and then specifically 34 weeks and under, and both of those actually rose here at KU in comparison to last year. So we are not seeing that.
And just to say, our NICU sends some children from other places, but mostly it's from our own deliveries. We're a very busy place. You guys do a lot of high-risk pregnancies, and so there's, we do have a fairly busy NICU up there.
Mm-hmm. And I think we have not seen that decrease here. But I have read the same articles, but we have not seen that reflected here.
Dr. Pressler, any comments about that? I'm sure you've seen that literature as well, and thoughts about it.
Yeah, I have. And I think there are some who guess it maybe we're less likely to have preterm deliveries when moms are staying in more, resting more, not necessarily out and about doing all the things up until the time of delivery. But I agree, we haven't seen that borne out. Our NICU takes babies, anyone who is born under 36 weeks gestation, automatically. And of course, if they're sick at all. And I agree, in the nursery and our NICU, we've not slowed down one bit, busy as ever.
All right. Other questions?
Channel 9 is asking, what is the biggest misconception about going through pregnancy during COVID?
Carrie?
There's a lot of questions, right? This is a time that, certainly pregnancy is anxiety-provoking and question-provoking, and then we add it in the middle of a pandemic, and it seems a logarithmic increase. Misconception. I think honestly it was that if you were positive, we would separate you and your baby, no questions asked. And we saw a lot of fear about that. And we heard that that was driving a lot of patients to not come in for prenatal care and turn to perhaps a home birth option. So we have done a lot of trying to really talk to patients that it's not an automatic separation from a woman that would test positive. And Dr. Pressler can talk, that has actually even changed a little bit in the past week. So, but that is not something that we automatically do.
Dr. Pressler, any other thoughts?
Yeah, I've gotten the same question from some of my patients that I see in clinic who are expecting a second or third child. What if I test positive? And I agree that that's the biggest fear, is that I'll be delivering a baby alone and then be separated and alone right after birth. We've always given informed choice to our families. So even if mom is positive and there might be a risk to baby, we've talked through those risks and benefits. But in the last week, the American Academy of Pediatrics actually revised their initial guidelines. And now they recommend following essentially the standard practice. And here that means that baby stays in your room as long as we'll assume that mom is well enough to take care of baby. We'll still try to provide some separation and protection for baby. Usually that means that baby, instead of being in an open crib in the room, will be in an isolette, so that if mom's coughing or sneezing, things like that, that droplets aren't landing on baby. She'll wear a mask when she breastfeeds and things like that. But otherwise, babies get to stay with their parents. And even if you're positive, the other good news is that person is going to participate in caring for the baby, learn how to take care of their child.
So, the children, the young children, do they do poorly with COVID-19, or do they do relatively well? Dr. Pressler?
Good question. The good news so far, they seem to be doing really darn well. There are some isolated case reports of kids getting sick, but I mean, everybody knows about those case reports because there are so few of them happening. What I think is really interesting, there are some studies, admittedly small, because people don't study healthy children that much. We wait for people to get sick before we study them. But looking at the rates of newborns who become positive over time after being born from a mother who was COVID positive, and only maybe a third of those babies tested positive even later on after going home with her. And they weren't necessarily getting sick. They were sort of an asymptomatic. We found the virus in a nasopharyngeal swab, and that was about it. We probably never would have swabbed if we were waiting for symptoms. So I'm thankful as a pediatrician that at least these kids that I care for still seem to be doing really, really well.
Yeah, consistent with what we've seen for children 9 and under, really, in many ways. Yep. So, good.
Channel 9 sent in 2 more questions. The next one is, what is your overall biggest concern as a doctor about pregnancy, giving birth right now? Your overall biggest concern.
I don't think that's necessarily changed in COVID, in all honesty. My concern is how do we have a healthy mom and a healthy baby? So it's staying healthy during these times. It's, somewhat difficult as we tell people to stay home, but we want you to still be somewhat active. So, getting out and walking outside and keeping, weight down during pregnancy, that helps your blood pressure, all of those sorts of things. So overall concern is just healthiness of the mom and therefore the baby. I think it really hasn't changed during this time.
Carrie, do you think the mental stress of COVID has impacted pregnancies?
So there's, as I mentioned earlier, I think pregnancy is a very highly stressful and anxiety-provoking time.
I was super
especially first-time moms, right? And this just adds to it because we see the stress of pregnancy and then the stress of the pandemic, and you add those together. I think the hard part, as Dr. Pressler also mentioned, is there's a lot of unknown, right? So we're just getting back some data and things that we think we know or we think we understand, but things are changing daily. So just that unknown, I think, is a little bit difficult. And that's why we've really tried to do our best to provide great information for our patients. That would be, the ability to talk to physicians or handouts, or when we come to labor and delivery, still allowing visitors to be there, and trying not to change our processes too much to still keep the patient safe.
Okay. Yeah.
And the last question from Channel 9 is, would you recommend that people maybe don't get pregnant during COVID, during the pandemic?
It's a great question, too. And I highly encourage it. That question is coming across your head, that you talk to your physician about that, because I really think it's probably a very specific, has specifically to do each patient. It's not a blanket statement. For instance, perhaps we have a woman who has struggled with infertility for a year or so, and they are older. Then I'm not sure that waiting is going to be the best answer for that patient. Or perhaps a patient has multiple comorbidities that already places them in a high-risk group. Perhaps that patient might be better off waiting a little longer. So certainly, if that is a question that's coming across each person's mind, I would highly recommend that they talk to their physician.
All right. Any other media questions? All right. What about from our listening audience today?
Oh, yes.
Lots of questions.
Yes.
Lots of
Coming
moms.
in. Yeah, you've answered some of them, but Katie wants to know if babies are allowed to visit the nursery at a birth center, and are children, siblings, allowed to come and visit? Are we allowing? I don't. You can only speak for us, probably, but
I'll let Dr. Pressler take that one.
Yeah. Right now, unfortunately, we're trying to limit the number of people in the hospital in general so that we don't have lots of people coming and going. That's been one of the more difficult things, is that the siblings of a new baby don't necessarily get to come to our hospital. We wait to have that meeting until baby goes home. I know that's been a challenge for some patients.
Melissa is asking, any indication of damaged placenta from positive mothers or babies with damaged brain tissue of a baby born to a positive mother?
Dr. Pressler, go ahead.
So to my knowledge, there is a single case report study of a infant with neurological damage that had positive placenta cord blood born to a positive mother. A single case. That is the only one that I am aware of.
I think there's been a lot more deliveries than that.
Yeah.
We have had a lot more deliveries than that. And that wasn't here, of course, but that is the only one that I am aware of in the literature. There have been multiple places that have been collecting placentas and cord blood and various things, but that is the only one, to my knowledge, that has shown a neurological change in outcome.
Whitney, any other thoughts from your standpoint?
No, I agree completely. That's the same case that I'm aware of, but haven't seen anything else. And in our hospital, we've had really good outcomes for all the babies born to a COVID positive mom.
And just to say, if you think about the etiology of COVID, it's coronavirus. Most, you can have a cold and deliver. So unless you're getting the really severe side effects from coronavirus, it should be okay, right? And kids do seem to do pretty well with coronavirus.
Yeah, and I saw there's a new study out. It's smaller, but they actually looked at placenta. And so because they, just as you said, they have not found a lot of infection or even evidence of the virus in the placenta. And they think maybe one of the reasons is that it's missing one of the enzymes, the TMPRSS2, not the ACE2, but one of the enzymes to help infection as well. So, but again, that's still being looked into. But from what you said, yes, identifying the virus in the placenta is extremely rare.
Virginia, she read a study about breast milk, and she wants to know whether antibody-positive moms are passing antibodies on in their breast milk.
What do you think, Whitney?
I actually get that question a lot. And to answer it properly, I think first we have to remember that there are different types of antibodies. And when people think of antibodies in general, I think most people are thinking of something called IgG antibodies. That's usually what we measure if we're looking at a response to an infection or a vaccine. That's what we look for in your blood. That type of antibody is not in breast milk really in any significant amount. It has more IgA antibodies, which definitely play a role in keeping baby healthy and keeping everybody healthy. And it can be protective, but it's not the same type of antibody that we look for when we say someone is antibody positive, if that makes sense. So breast milk definitely has some antibodies, offers great protection, is the ideal nutrition for a newborn, but not necessarily specific COVID antibodies if you've had the infection.
Okay. Any other thoughts with that, Dana?
No, I mean, I think, just as she said, and we continue to do studies, and I'm sure as we move forward, we will learn more about that as well.
Katie's asking, should grandma and grandpa quarantine before they come to watch first child? And then another viewer is asking, when about taking baby home? Should there be people not coming over to visit?
So let's go both ways. We're gonna get the early. We'll go to Whitney and Carrie, and then we're gonna see what Dana's thinking. I'm curious about this. If y'all get the same answer, what would you tell your folks living in Delivery?
Well, I haven't seen my parents in a long time, so I would recommend that they quarantine. I think it also depends how well you think your families or visitors have been social distancing themselves. But we have this talk a lot as patients are nearing delivery time, but who should come and how, and I think it's important. I recommend it. I realize sometimes that can't happen due to need of childcare and things, but I think it's important to talk about, and I do recommend it.
You know, I hear it on the other end because, Whitney, my patients will say to me, my daughter delivered my son, how soon before I can go see the baby? Is it safe for me to travel? I want to go to Seattle with my underlying chronic lung disease. I mean, what do you think about that? And I could have been any town. I picked on Seattle. But.
Sure, and it's so hard to keep a grandma and grandpa away from a new baby. I think I agree. If people are willing and able to quarantine and social distance for a good amount of time, that's ideal. I would love that for all of my patients. Understanding that's not always possible. I've been giving the advice to ask a lot of questions of people who want to come visit the baby or people that you want around to help take care of your kid. Either older sibling or new baby, make sure that you are comfortable with what they've been doing. So if grandma and grandpa have been going to lots of happy hours or really big gatherings outside or something like that, then it would make me a lot more nervous than if they were wearing masks, washing hands, trying to stay in as much as possible. I feel better about that. I will also say, even when we're not in the middle of a pandemic, I give the advice to all families taking home a new baby. Be careful about who comes in your home. Make sure that everybody is healthy. Make sure that everybody washes their hands before they hold your baby. The two things that have been added now are I would recommend they wear a mask before they come into contact with your baby, and that you ask those questions to make sure that you feel comfortable with the risk you're accepting bringing someone into your home.
I'm thinking if grandma and grandpa are out partying, we got another problem.
Right.
What have you said, Dr.
Or limit the gatherings, like you said, funerals, other get-togethers, graduation parties, things like that.
Yeah, those are the things you're not supposed to do.
Right.
Yeah, right. Yeah. Just I didn't want our listening audience to be confused to think we were recommending funerals. We're not recommending that.
Again, knowing who is in your bubble, having conversations with the grandparents. Understanding that just as we do with preoperative patients, although we test them and we say once you get the test, or even before that, please quarantine yourself. So if you can anticipate maybe when delivery is, which you always can't, we know that, but if you can try to anticipate, start your quarantine before that. Start doing those healthy practices, staying out of public places, wearing the mask, doing the hand hygiene. And so by that time when you have delivery, it may be a little bit easier to say, okay, I accept what you've been doing and let's go. We think we can have you see your new grandbaby, in a healthy manner.
Last week I was out for a walk, and it was clearly a grandparent first meeting on the driveway. It was very cute. Yeah. They brought the baby out to the driveway, and the grandparents were kind of saying their distance back. But I think there's different ways that you can contact too.
Okay.
Margarita's asking, if a patient is positive and asymptomatic after the baby is born, are you taking any other special precautions with clotting?
With clotting? Mm-hmm. Okay, that's an interesting take. Whitney, what do you think?
Not for baby. Fortunately, when mom is positive, if baby comes out and is asymptomatic and healthy, we treat baby as a healthy baby. We'll do a little bit more follow-up in person, a little, and telehealth some just to monitor baby, make sure that they don't get sick after they go home with a COVID positive mom. But no special issues for clotting for baby. I don't know about mom. Dr. Wieneke would probably be able to answer that.
one of you, there you go. What do you think?
We are doing anticoagulation for moms that are positive, even if asymptomatic, and that comes from the report of increased clotting and some case reports out from the cities that were a little bit ahead of us in the pandemic about moms that were having a little bit more rapid decline postpartum, and postpartum is a time that you are hypercoagulable or are set up for a clot anyway. So putting those two things together, we do recommend anticoagulation for our positive moms.
So how long did they anticoagulate for?
So that has changed a little bit, but they are anticoagulating now for, I believe, 2 weeks.
Okay, for postpartum or before, but nothing before. If you knew they were positive, would you give it for?
Correct. There is a lot of discussion about if that should take, if we should be doing that, but at this time we are not. A lot of our women are on an aspirin for other reasons for anticoagulation, but there's a lot of discussion amongst groups about if we should be adding aspirin for that situation, or even like a local Lovenox.
Okay. I just learned something. I love when I learn something. Thank you.
David is asking, what kind of complications can happen when mom is positive with COVID?
So it'd be the same, really the same complications of a non-pregnant patient. We're worried about respiratory failure, and then, as being a pregnant mom, that could then lead to complications with baby. But really the complications are that of a non-pregnant mom.
So Dan, are you seeing anything else from the ID standpoint about moms?
No, I think we have identified, like you said, a lot of asymptomatic moms coming in. And I'd still want your take. I still think it's probably more dangerous to have influenza when you're a pregnant mother rather than COVID-19, from what we understand about complications, although there was that, the CDC stance of saying you're more at risk of ICU, and those numbers were small. I think it went from 0.9 to 1.5 or 0.6 to 1. But still, I think in general, we really need everybody, and especially pregnant moms, to get their influenza vaccine. You are still at high risk of complications from influenza compared to COVID-19.
And I think that's what scared us the most about, when we were entering this, is
Yes.
that we know what flu likes pregnant moms, and it likes them
In a bad way.
in a bad way. So
Yeah.
every flu season, leading up to flu season, we talk the importance of the flu vaccine, because we know that it was affecting, and we see, people in the ICU all the time with influenza. And you are correct. So, up in the initial data did not show that there was a preference for a pregnant woman for COVID, or even more morbidity, but the one study did show more likelihood of a pregnant woman being admitted to the ICU and being mechanically ventilated, but there was no change of mortality. And that study was very small and didn't stratify a whole bunch. So, but that is out there. The numbers are still very small, but I suspect we'll be hearing more about that.
And I may be wrong, but I don't know that we've seen that increase here locally, have we?
Here on our campus,
Yes.
we have not. We have had a lot of what I would call mild, maybe a moderate, but overall we have seen a lot of asymptomatic or mild positives.
And you know how many people have been positive just on routine testing for us? I don't know the number. I should probably know that off the top of my head, but don't.
I have a gestalt, but I would hate to be quoted saying
No
that.
worries.
So
Then we won't say it.
yeah.
I have another reporter that would like you to follow up on the opening comments about the viral video with the doctors, America's frontline workers. Specifically,
Yeah.
the reporter is saying the doctors claim hydroxychloroquine works to cure COVID, and that kids need to be back in school regardless. They would like you to speak specifically to those two things.
Okay, well, I'll take the hydroxychloroquine on.
Yeah.
And we both do that one.
Yeah.
The answer is no. It's
Correct.
it's
Absolutely.
just, I don't know what literature they read, but it wasn't real literature. And in fact, there was an article that just came out recently that read that the effectiveness of remdesivir is lessened when you give hydroxychloroquine. So not only should you not take it because it leads to bad outcomes and
Correct.
it doesn't prevent disease, but it can make other therapies less effective, Dana.
Yeah, absolutely. It's probably just not being able to keep up with the literature or not reading the literature. The best literature that we have shows that hydroxychloroquine has no benefit or is actually unfavorable and can actually worsen your outcomes. So, again, that's the majority of the best literature that we have, the best studies that we have, the best data that we have.
And it may change. The hard thing about a pandemic, we said before, To quote one of our staff who wrote this down here a while back, we're building the airplane while we fly it. And sometimes we figure the parts don't fit.
Right.
And that's kind of hydroxychloroquine. It looked theoretically like it was going to work. We even initiated a study here, the HERO study, trying to look at the use of hydroxychloroquine for frontline workers. The reality is it hasn't worked, despite everybody's trying to postulate that it should.
Right.
Maybe some other days we'll find a time and a place where it worked. It worked. There was a report that came out in early June about working in some hospitals in Detroit. Very select patient population in that setting, however, and I think since then that's not been followed up with good credibility.
Yeah, and I think there were confounders with that, with the anticoagulation being used in those patients, with the steroids being used, so there were other issues there. But again, I think it is still being studied, but currently the best evidence that we have would show no benefit or actually unfavorable and actually increase harm.
Yeah, and I think there's a difference between a frontline healthcare worker and people who actually do research in the field. And I think you have to look at the folks who are asking the science questions and looking at data to answer those questions as opposed to maybe their own emotions. Now, the second follow-up to that question is that we should go back to schools, full bore reopen. Okay, Dr. Pressler, I'm going to turn to you after, and you can discredit everything Hawkeye and I say here. I think it depends partly on age, and it depends on the health of the people at home. It depends on how healthy that kid is. I mean, there are just a lot of variables, and a blanket statement, every kid should go back to school without a mask, is a fool's folly.
Right. Yeah, absolutely. And the infection dynamics in that community, in that school district, is extremely important. In that county. We would like to see lessening cases every day, not a steep rise in cases, or at least a stable amount of cases, and understand that. Keeping the children safe and the staff safe. So again, you can't make that blanket statement. You have to understand what your community is like.
Dr. Pressler.
The $1 million question, right? I agree it's complicated. And as far as schools around here, most of them are giving families options about how they want their kids to attend school this year. And that can be going in person, although we don't know what that might look like really. It might be distance learning, similar to what's happened at the end of the last semester, though with a little more planning and preparation, I imagine it'll be a lot smoother. And then some people are choosing to homeschool, at least for the first semester, so that they can stay at home and have a little more flexibility rather than doing the distance learning with their teachers. As a pediatrician, I worry a lot about our emerging readers in particular. So those kindergarten, first and second graders who are starting to get these skills, if they don't have them yet, there's the potential to be behind lifelong even. Everything we know about early intervention says that it's early intervention for a reason. We make these things and we teach kids these things at this age because this is when it's the best time to do so. And balancing the risk of not learning these really important skills with the keeping everybody safe is just extraordinarily difficult. So I agree that for every individual family, you have to think about where your kids are in their school. Are they high schoolers who can do a lot more on their own? Are they kindergartners who have the attention span about 2 minutes long, and asking them to sit in front of a screen all day is problematic? Do you have other resources and people who can help guide that? Do you have high-risk people at home that we need to protect? There are so many questions. And I absolutely agree, you have to consider where we are in this community also. And I'm glad that at least Kansas has pushed back the start date of their schools till after Labor Day, so that we have a little bit more time to hopefully, I agree, at least get to a plateau, some steady state of new cases rather than rising. It'd be great if we could get to a decrease and people will be able to do it more comfortably. But I think when we do, we've got to be smart, make sure that kids know how to clean their hands, make sure they have masks. Kids actually do a really shockingly great job of wearing them, probably better than a lot of adults I know, because they're busy. They put it on and then they get distracted and they go. Hard question, no straightforward answers.
No, there's not a straightforward answer because the pandemic's not straightforward, and so this is symbolic of everything we've settled the entire program, and I think that it was disappointing to see our colleagues nationally get up on the steps of DC and say stuff that's just so far off off what's going on in the science world. And I think that they weren't wearing masks, they didn't follow any rules of infection control, and I just thought, how many of you would want your surgeon in the operating room to come in, open you up, and not have a mask on? Would you think of doing that?
No.
Okay, you got to follow up on the no, because I agree, but follow up there. Don't leave me hanging.
Straight to the point.
Of course we wouldn't.
It's a
those are simple
terrible
infection
idea.
rules, right?
Yeah.
Principles. We would never think to do that.
It's a terrible idea. So why do you think it's safe in public in the midst of a pandemic to wear a mask? Not wear a mask. I don't. It's just anyway. Okay.
Caitlin wants to know, am I at greater risk of miscarrying in my first trimester if I contract COVID?
Yeah, great question. And at this time, we do not think so. Lots of studies looking at this. We hear reports of our people might be seeing this, but there is nothing proven on that right now.
Hey, so Gary, kind of thoughts. So you and I've had this conversation a couple of times. I'm just kind of curious to see where you are. At other times in American history, when people were forced inside, there were a lot of babies.
Yeah.
But that's not, you and I were talking about that was before. You said, I'm not sure that's going to happen, the pandemic. But people
So we are
too scared.
entering Chiefs boom again right now. So we are entering, if we project, probably our busiest months coming up due to the
Super Bowl.
And people were excited in Kansas City, and this is what happens. We saw it at the Royals,
we're
right?
blaming Mahomes.
A lot of babies named Patrick.
Correct.
Yeah.
That actually is a great study, right?
The girls are named Patrick.
So we are approaching that, and after that, I do not think we're going to continue to see the boom. We track our new OB visits, we track our ultrasounds and things like that, and they have studied. They haven't gone up, and I do think and there's a lot of articles about this that people are just having a little questioning what's going to happen during the first trimester or what happens during pregnancy, but also the economic impact right now, and the realization that kids aren't cheap.
Yeah, they're not cheap. No, they're not cheap at all.
And being a little bit, putting that all together, I don't think that we are going to see a COVID boom of pure numbers of babies born.
Are the medications that we're using on COVID patients okay for pregnant women?
Yes, we would treat most of them the same way.
Yeah,
but
they look to be safe. Remdesivir looks to be safe.
Yes.
Obviously, steroids on the right. If you know how to dose it, if you're going to be an obstetrician, certainly. And then again, you've already commented on the anticoagulation. So I think those three things are really what has helped us with our treatment of COVID patients, and also the convalescent plasma.
That's the 4-drug cocktail, right? That we've got.
Yeah,
right now
absolutely.
Active, so.
Certainly light years of where we were in February and March.
And that's why we think we're having better outcomes in patients, is because we actually
helps.
do have some therapies that are relatively effective.
Lindsay has a question for Dr. Hawkinson. She writes, you flew earlier during the pandemic. Would you fly today?
I probably would not. I think the time 5-6 weeks ago is different than the time right now. Now,
Is that because of the community prevalence that's making you feel like that there's just a higher likelihood of having someone on the plane?
There's probably more people flying as well, so the number of people who are in the airports, in the planes is more, and just the higher amount of community prevalence, certainly. So I think driving is still good. I would not fly at this point in time. But that's something we're going to continue to evaluate every few weeks, every month, because the time right now is going to be vastly different than the time in 4 weeks from now. But certainly, looking back, if I were to fly now, I would be canceling that trip.
It's funny. So I'm going to go up and meet my daughter's new boyfriend. My daughter has a boyfriend. Andre, I'm coming to meet you. Watch out. But we're not going to fly. Well, first of all, we can't go to Chicago. It's because they won't allow people from Kansas into Chicago without self-isolating for 14 days and quarantining. So can't do that one. So then it's like, okay, well, we're going to meet somewhere in between. We find a place we think we can go, and we can meet him and see, what is this person like? We'll do it with masks on. We'll do it socially distanced. We'll be outside, get him figured out, and then we'll decide he's okay or not, and then we'll go from there. So he shouldn't be afraid at all, though. I'm just kidding if you're out there. Well, sort of. No, next
Caitlin is
question.
asking, for children who have experienced simple or complex febrile, am I saying that right?
Febrile.
Febrile, thank you, I'm not a doctor. Seizures with other viruses, are you seeing these children experience them with COVID?
Great question.
Okay, Whitney, we're turning to you on that one. I'm
Not yet. Yeah. And febrile seizures can be terrifying for a patient and a family. what we know about them, usually there are not a lot of long-term consequences, thankfully, and it can happen with any reason for a fever. So it can happen with influenza, it can happen with an ear infection, it can happen with anything. So I imagine it's certainly possible. It probably will be reported at some point that we'll have febrile seizures with coronavirus, but so far, oddly enough, no, we haven't seen it.
All right. Time maybe for two more questions.
Okay, so here's one. This person says she does not believe that there have been hot spots in daycares, and we had one child case with no spread since then. Would you think that that's a good reason or an argument to go back to school?
No hot spots in daycares. Whitney, can you confirm that?
Yeah, it's another mystery of coronavirus that, unlike other viruses, I use influenza as an example a lot because we're all so familiar with it. With influenza, kids will get it and they spread it around daycares like wildfire, and they bring it back to their homes, and now everybody's sick. With coronavirus, it seems to be for whatever reason, and I think we all have our guesses in our minds. Kids don't necessarily give it to adults very often. It's usually an adult giving it to a child if they get sick. Although the reverse can happen, particularly as kids get older. But for young kids, child to adult transmission is fairly rare, and even child to child transmission is relatively uncommon. We see little groups in daycares here and there that are getting sick, and most commonly that's because the daycare worker had it and accidentally gave it to the children before they had symptoms. So those kids got it and are in quarantine, but I agree, even their families, for the most part, are not getting particularly sick. Household transmission is lower in those cases than others. It's very odd. As far as what that means for schools, I can't say. Some of it, I think, is guaranteed to change just because we think of daycares are typically really, really small kids. So if I'm talking about toddlers up to preschool, they're just different than even elementary school kids, and certainly different than middle schoolers and high schoolers in terms of their physiology, how they react to the virus, how they spread the virus. All of that is just different. So I'm not sure that we can use the good news about daycare necessarily to say schools are going to be okay yet. I think we got to learn more.
I think what you just said is puberty is terrifying. And as a parent of 3 children, it was terrifying then, and it terrifies me now. So I think that, but part of it also is that cutoff. The older you get, the harder it is, or the more risky it is. And for young kids, again, you mentioned reading and things like that. Probably is safe to go back to school. You start hitting that 8-9-year-old, you got to start questioning what's going on at home, how healthy are everybody, and what all's going on. Let's wrap up today and get some final thoughts. Carrie, I'm going to start with you. Final thoughts or ideas you want to make sure our audience hears.
I think we've learned a lot over these past few months about pregnancy and newborns and COVID. So certainly, feel free to reach out to your physician and ask questions. There's still some unknowns, of course, but we every day are learning more and are working to make a safe environment throughout the entire pregnancy and during the labor and delivery process. And I just think it's important to have that open dialogue.
Yeah, you bet.
And the other thing is, what we didn't touch is that what can a pregnant patient do to stay safe, or what extra? And it's really not the extra, it's that just being cognizant of the things that we talk about daily for everyone, right? So the importance of wearing the mask and hand hygiene and social distancing, especially as you approach delivery time. Those are the important things I think to remember. Yeah,
once again, the pillars of infection control are with you wherever you go. Dr. Pressler.
Yeah, Dr. Wieneke took the words right out of my mouth. The biggest thing I've told every patient for the last couple months is wash your hands, wear a mask. For kids, I would say as they're getting older, so school-age children and up, for sure, have them practice wearing a mask. If you think that you might go back to school or you want to take them around, even practice wearing it for little bits of time at home so that they get used to it. They're not afraid of it, things like that. Make it a fun thing. They can pick out a cool pattern or wear one that matches you, whatever it takes. Those are good things to do now rather than in September when and if people go back to school. And in the meantime, just stay distant, stay safe.
Stay safe.
Yeah, kind of back to that first question. I wouldn't fly right now. If you absolutely have to fly, please wear a mask, wear your eye protection. Avoid touching your hands to your face, your eyes, your nose, your mouth. And as we get forward and closer to school opening, although it's been delayed, everybody please continue to wear a mask. Encourage other people around you to wear masks. Don't meet in large groups, because we really, for the health of our children and us and other loved ones and the staff in the school, we need to make sure that that curve of new cases is either on the downtrend or stable, because we do need to continue to be open as we can be and not have further quarantines and shutdowns moving forward.
Hey, a couple of quick words. Tomorrow, Greater Kansas has not escaped, and we are seeing a great rise in some of the rural counties, has not escaped COVID-19. We'll hear from Dr. Heather Harris, who's the medical director of our Hayes Med campus, and Dr. Jennifer Jackson in internal medicine in Wichita and Sedgwick County. We're also a hotspot for COVID-19. And patient Anil Garmacher, I think I did it right, a rural Kansan who's back in the hospital. He will update us on his medical journey with COVID-19. Also, a couple of quick mask photos. Jamie sent us 2 great examples of creating a new normal. Lucas likes his camper masks, and the Chiefs. Jamie writes he's happy to wear his mask out in public most of the time. He's practicing at home. And Hannah likes coordinating her mask with her outfit, hot pink on a church Sunday. When my kids were young, I made up this song I would sing to them, and I'm not going to sing again. Those of you who heard the video last week know that that's a really bad idea in a freezer or in real life otherwise. The last line of this song was, no matter where you're going, no matter what you do, Mom and Dad would always love you. And that's true. The update to that song is, no matter where you're going, no matter what you do, wear your mask, wash your hands, stay safe. Remember, there's still no place like home. We'll see you tomorrow.